Waking up multiple times during the night to urinate. Struggling to fall back asleep. Feeling exhausted every morning even after what should have been a full night's rest. If you're over 60 and this sounds familiar, there's a reason, one that may surprise you. It could be your nighttime habits. Small, everyday things that are quietly contributing to an enlarged prostate. Also known as benign prostatic hyperplasia, or BPH. What's worse, these habits aren't just disturbing your sleep. They could be affecting your long-term urinary health and quality of life. But the good news is you can take back control. In this video, we'll uncover the most common nighttime habits that can worsen prostate enlargement. And more importantly, how to break them to improve both your prostate health and your sleep. Let's begin. Understanding the prostate after 60. To understand why these habits matter, we first need to know what the prostate is and how it changes with age. The prostate is a small gland about the size of a walnut. It sits below the bladder and surrounds the urethra, the tube that carries urine from the bladder out of the body. Its primary role is in male reproductive health, producing seminal fluid. But as men age, especially after 50, the prostate tends to grow. This growth is usually non-cancerous and is called benign prostatic hyperplasia, BPH. Now here's the issue: as the prostate enlarges, it presses against the urethra, making it harder for urine to pass. This results in frequent urination, especially at night, a weak urine stream, a feeling of incomplete bladder emptying, urgency and occasional leakage. What most men don't realize is that certain nighttime habits silently accelerate this problem. Let's go over them one by one. Habit number 1: drinking too many fluids before bed. This is the most obvious and the most common. It seems harmless: a glass of water, milk, or herbal tea before bed. But as the bladder fills overnight, it has to work against the pressure from the prostate. For men with an already enlarged prostate, this can lead to waking up every 1 to 2 hours to urinate. How to fix it? Stop drinking large amounts of liquid 2 to 3 hours before bedtime. Avoid diuretic drinks like tea, coffee, or alcohol after 6 to 7 p.m. Focus on staying well hydrated during the day, especially between morning and early evening. Habit number 2: late night caffeine and alcohol intake. Caffeine and alcohol are diuretics. They increase urine production and irritate the bladder lining. Having coffee in the late evening or a glass of wine at night might seem relaxing, but they make the bladder more active and more likely to wake you up. Plus, caffeine can tighten the bladder muscles, making symptoms of urgency worse. What to do instead? Switch to decaf or herbal teas that are caffeine-free. Avoid all alcohol at least 4 hours before bed. Try calming alternatives like warm chamomile or turmeric milk. Habit number 3: heavy, late dinners. Eating large meals late at night can slow digestion, increase abdominal pressure, and worsen urinary symptoms. Spicy, greasy, or processed foods in particular may irritate the bladder and prostate. Also, lying down after eating can cause acid reflux, which puts additional stress on your system, disrupting your rest. Better alternatives: have your last major meal at least 3 to 4 hours before bed. Choose a light dinner with fiber, lean protein, and cooked vegetables. Avoid red meats, spicy sauces, and fried foods after 7 p.m. Habit number 4: holding urine too long. Some men make the mistake of holding in urine while watching TV or finishing a task, especially before bed. This habit trains the bladder to overfill, weakening its muscles and worsening the symptoms of BPH. It also increases the risk of urinary tract infections and bladder damage. Healthy habit: empty your bladder completely before bed. Don't delay bathroom trips, listen to your body. If needed, double void, urinate once. Wait a few minutes and try again to fully empty. Habit number 5: skipping bathroom visits during the night. Trying to push through the night by ignoring the urge to urinate can backfire. It leads to disturbed sleep due to bladder discomfort, and potentially increases the risk of urine retention, which may require medical attention. If you feel the urge, it's better to get up and go, rather than toss and turn for hours. Key tip: if you're waking up more than twice per night for the bathroom, it's worth tracking your fluid intake and consulting your doctor for a BPH evaluation. Habit number 6, lack of physical activity during the day. Yes, this affects you at night too. Men who live a sedentary lifestyle are more likely to suffer from BPH. Physical activity helps regulate hormones, reduce inflammation, and promote healthy blood circulation to the pelvic area. Sitting for long hours without movement can worsen pelvic congestion and increase pressure on the prostate. Try this instead. Aim for at least 30 minutes of light exercise daily, walking, stretching, yoga, or cycling. Avoid sitting for more than 1 hour at a time without getting up. Consider pelvic floor exercises, Kegels, which support bladder control. Habit number 7, ignoring chronic stress and poor sleep hygiene. Stress and sleep disturbances create a hormonal imbalance which can affect prostate health over time. Cortisol and adrenaline spikes can irritate the bladder, tighten muscles, and lead to more nighttime bathroom trips. And the less sleep you get, the more your body remains in a state of imbalance, further worsening prostate symptoms. Simple solutions: set a consistent sleep schedule. Turn off screens 1 hour before bedtime. Practice breathing exercises, light stretching, or meditation. Keep your room dark, cool, and quiet. Habit number 8, not managing weight or belly fat. Excess belly fat raises estrogen and lowers testosterone, 2 factors that influence prostate growth. Studies show that overweight men have more severe symptoms of BPH and poorer sleep quality. A bulging belly also puts direct pressure on the bladder and prostate. Healthy strategy: focus on a diet rich in whole grains, vegetables, and healthy fats. Cut down on sugar, processed foods, and fried snacks. Engage in daily movement, even if it's just a walk after dinner. Tips for prostate-friendly sleep. Let's now look at what you can do at night to actively support your prostate and sleep better. Elevate your legs for 30 minutes in the evening to reduce fluid buildup in the lower body. This prevents nighttime urination when that fluid shifts during sleep. Consider saw palmetto supplements after consulting your doctor. Some studies suggest it helps reduce BPH symptoms. Track your symptoms. Keep a journal of fluid intake, diet, and urination patterns to notice what triggers your nighttime urges. Stay consistent. Good habits compound over time. Making small nightly adjustments can make a big difference in a matter of weeks. Conclusion: your prostate doesn't suddenly grow overnight. It responds to the daily choices you make, especially in the evening. By avoiding these common nighttime habits: excessive fluid intake, caffeine and alcohol at night, heavy meals. Remember, always consult with your doctor. If you're experiencing severe symptoms or if you're considering changes to your routine, prostate health is individual, and your healthcare provider can guide you in the best direction. If you found this information helpful, don't forget to hit that like button, subscribe for more videos, and leave a comment below if you have any questions or tips to share. And take care of your health.